In Health Watch, it is one of the easiest ways to bond with your new baby. Breastfeeding. August is National Breastfeeding Month, and the American Academy of Pediatrics recommends exclusive breastfeeding for about 6 months. Joining us today is Erwin, a lactation consultant with Cook Children's Medical Center. Holly, thank you so much for being here.
Absolutely. Thanks for having me.
Can we talk about some of the benefits to the baby when moms nurse?
Absolutely. There are a lot of benefits to breastfeeding. One is it lowers the risk of SIDS, but also it helps with illnesses, just your common childhood illnesses like colds, the tummy bug, but even bigger stuff. It lowers the chances of childhood cancers, obesity later in life, and there are many other benefits.
Those are significant benefits, but there are also benefits for mom too.
Absolutely, yeah. So we know that a mom who breastfeeds has a lower chance for postpartum depression. She lowers her uterus contracts smaller, so she loses that postpartum weight. But bigger than that, it lowers your chance for a heart attack, for breast cancer, and some other female cancers.
And so what advice do you have? For some women, this comes very naturally to them, and for others, they struggle with it a little bit. It's a little bit of a challenge. So what resources are there for women in this boat?
There are lots of resources, and it is hard. It's hard on mom and baby. I actually am a lactation consultant, and I do it virtually, so it helps those moms who don't necessarily want to get out of the house or go somewhere. So there are resources in person, and there are also options like what I do.
And talk to me a little bit about what you do.
I do virtual consults. So just like the lactation consultant who comes into your room after you have the baby, it works a lot like Skype. Mom's on the other side and I'm here, so she can stay in her pajamas. She doesn't have to wear makeup or get ready. And all those questions that she needs to ask somebody, whether it's a latch issue or just, I have 1,000 questions and there's not enough time to ask my pediatrician, I'm there for that.
So very convenient. Another question, when moms are ready to go back to the workplace, what are some of the rights that they have if they want to continue nursing?
Actually, in 2010, part of the Affordable Care Act was that it was passed for employers that have over 50 employees. They have to give an adequate space for pumping and time for pumping. They do not have to pay for it, but they have to offer that to their employees.
And I do have another question for you. This brings about sometimes a lot of emotions, a lot of feelings, and some women do face mom guilt or shaming from other parents. These are women who have tried, but they have to end up supplementing with formula. What words of wisdom do you have for them?
Well, first of all, we just want your baby to grow. We all know that whether your baby's on breast milk or formula, they're going to be perfect, smart, beautiful, all those things that you want. And also, breastfeeding doesn't have to be all or nothing. Any breast milk still has benefits to it.
And then just while we have you here very quickly, what are some of the initial things that you want to do right away to improve your chances or to make this easier on you and baby? Research before you go. Find out the things that you want to know. The more you know, the better you'll do. But also get off to a great start. Latch early and feed often. We know that empty breasts make the most milk. So the more that we can clear that milk out of the breast, the more our body wants to replace it to make more milk to feed for the baby later. Holly, thank you so much.
Absolutely.
I'm sure a lot of new parents are finding this very helpful. We appreciate your time.
Thank you.